Hi everyone, my name's Kim and I'm a registered veterinary nurse and also a volunteer for the British Veterinary Nursing Association, and I am currently the Honorary Secretary. I'm delighted to be joined today by Nicola, who will be eagerly answering some questions that we have prepared to celebrate all things vet nursing for Veterinary Nurse Awareness Month. We are also celebrating 20 years as well, which is incredible. So these interviews are going to be a real sort of celebration of the progression of the profession. I'm glad I got that right. So, Nicola, would you like to just tell us how long you've been qualified for and how you qualified?
Right, so I did a roundabout kind of route to veterinary nursing. So I started in practice in 1994. It's like a long time ago. So whilst I was still at school, and it felt like a work experience placement, but I ended up working there at the weekends, and it really sort of made me want to go into vet nursing. But I still wanted to go to uni and do all those things. So I did my GCSEs, I did my A-levels. And at that point, there wasn't a degree in vet nursing. It wasn't heard of. So I went and did another type of animal sciencey degree, but still wanted to vet nurse. I was just, that is what I wanted to do. So I circled around and back again and managed to get a job as a student vet nurse in a practice, and did the NVQ2 and NVQ3 in veterinary nursing, and qualified as a vet nurse. So yeah, it's quite a roundabout kind of way of doing it, but I knew that's what I wanted to do. And at the time, it's one of these things you don't always go, I'm going to do this, then I'm going to do this, then this. It's just the way life happens sometimes, and that's the route that I took.
Yeah, so it's quite interesting actually, because I did a diploma route, and so yeah, there's a lot changed, hasn't there, over the years in terms of how you can qualify. So that ties in quite nicely to the next question. What progression have you seen in the profession in the last 20 years?
Loads, absolutely loads. We have the foundation degree. The degree was a HND at one point, if I remember rightly. And I think that's really important, that we have different ways to enter the profession. We shouldn't be elitist in that you can only do it the degree route. There's roles for everyone, and there's academic abilities. And the thing is, vet nursing's a practical profession as well as a theoretical profession. And we all learn so differently that it's so important that we have these different routes that provide those learning opportunities so that we can have everybody that wants to do vet nursing to join. So for me, I'd say that obviously we've got medical, progressions and different medicines and stuff. But for me, I think that's the most important thing is that we've got all of these different routes.
Yeah, it definitely allows flexibility for people, doesn't it? If they want to do a degree or diploma, or I was certainly a practical person, so the diploma worked really well for me because I could work full time in practice and go to college one day a week. But if you're more education, then the degree route might suit you better.
Yeah, I mean, I've just not just, but a few years ago now, did my master's degree, and I always wanted to do a master's, and all the ones that were there already didn't suit what I wanted to do. So I had to just sit and wait until the right one came along, and it did. Purely because the number of people wanting to progress, the courses change, and it all works really, really well for everyone. It meant I could do it online. I'm a mum, working full time, so it meant I could do it as quite literally downloading lectures on my computer at the rugby club, watching my daughter doing her training whilst doing it in my car. So that flexibility is massive, absolutely massive. So I think that the education routes is so important, and it's helped so many people.
Yeah, so for you, that's your kind of like the biggest thing you've seen change over the last sort of 20 years in terms of how you can become qualified. What would you say the biggest change for you has been in practice over the last sort of 20 years?
Oh, wow. So yeah, we were talking before about digital x-rays, and yeah,
Yeah.
I do remember dipping my, my films and stuff, but also from lab point of views, having to do smears and counts. And it sounds silly, but just things like fluid pumps, how many animals were not getting their fluid requirements, and now they do. So there's so many different things, there really is. But again, being a consulting nurse, it comes down to, I'm going to say, communication means as well. There's so many different ways to talk to clients and access clients and accessing information. How many times have you had to, or you've seen the vet run to the back of the practice to find the BSAVA exotics manual? Well, now you can just Google the formulary you have as an app on your phone and things like that.
It's so massively changed, hasn't it? And I think as a consulting nurse, once myself as well, I think for me, I think a lot of things that had changed were things like even food. The options now available for pets is a little bit of a minefield, but in terms of veterinary prescriptions, it's a lot better, isn't it?
Yeah, there's loads more, obviously veterinary therapeutic diets. It used to be, one, maybe two brands. There was 6 diets in the range. Now we have a whole alphabet of different foods, and we've got that evidence now behind a lot of the different things. So that makes things easier to talk to a client about if you've got that evidence there. But I say a lot of that's going to nurses doing things like degree routes and doing projects for their diplomas and stuff, and then going out and having it published. We've got a lot more means of getting research evidence out there that the rest of us can use to help support what we're doing, and I think that's really key.
It's been exciting, really, the changes, I would say, over the years. We're celebrating all things vet nursing, so we're empowering what we can do here. So I think with all those changes, like you've just mentioned there, I think that we should be incredibly proud of the profession, shouldn't we?
Oh, yeah, definitely. I mean, 30 years ago, how many nurses were involved in research? Probably none. But now, I mean, I pick up research papers all the time, and I'm like, oh, I know her, or I know him, and it's not just opinion pieces or reviews of stuff. It's actual primary research, from universities and stuff, and I think that's fabulous.
And it's so detailed as well, isn't it? And it's amazing. And it's incredibly helpful as well. So all these amazing vet nurses doing incredible things. No, I agree. So one of the other things is that the key thing is that the veterinary nurse title has never actually been a protected title, and we are currently at the moment trying to get that protection, because we just feel as a profession we are not really utilising our skills as much as we can do, and we think as well that it would kind of give us more value as well. And as you've just quite rightly said, we've got all these courses now available to us in terms of education. So we are professional people, and we don't just want anyone to say that they can call themselves a veterinary nurse. So that ties in nicely with our last question there, Nicola. What does the protect the title mean to you?
It's actually a really difficult question because it's really broad, isn't it? And to me, and I get this a lot, I take my dog to be groomed. She's a King Charles Cavalier, and I get like people, like the groomers, like, oh, I used to be a vet nurse, and you're like, okay, and you talk to them, and actually they're not qualified. So and that, you get so many people say that to you. To me, being a registered veterinary nurse, where we have regulation already, which is great, but actually protecting that title, to me, is about safeguarding. It's about safeguarding the animals, so that we know that the person doing the anaesthetic on my baby, my family member,
Yeah.
is a qualified, regulated professional that is responsible for what they're doing. To me, it's safeguarding. There's so much there to do with patient care, increasing clinical outcomes. If someone knows what, and they know the underpinning knowledge behind what they're doing, not just doing it. And I'm in probably a little bit of a unique situation. I told you I started working in a vet practice in 1994. Didn't actually qualify till 2002 because I was doing my degree and then circling back. So it's quite a period. It's 8 years there where I was not a qualified nurse. I'm going to say the last 3 years of that I was a student nurse. But there's a great big chunk there that I wasn't qualified. I wasn't being taught. And I didn't know any of that underpinning knowledge.
Right.
Now that I know all of that, it really scares me what I was doing. So to me, protecting the title is about safeguarding our patients, patient care, and getting those better clinical outcomes for the animal, but also for the family of that animal. I don't like, yes, they're the owners of the animal, but they're a family member, aren't they?
Yes. Yeah, definitely. No, I think that's a really good way of answering the question, actually. So safeguarding and patient safety, really important. And something that I also think is, as a vet nurse, when my pets go to the vets, it's I think, I would rather have someone there that knows what they're doing. So and has that knowledge as well. No, thank you so much. It's a really short interview, but we wanted to just celebrate as much as we possibly could in a short period of time. I talked to Nicola for ages because Nicola's always been someone that I've admired, and if it wasn't for Nicola, I wouldn't have been a consulting nurse either. So I'm incredibly honoured to have been joined by Nicola today to do this interview. I'm glad she said yes to me. Thank you so much for joining us today and celebrating all things veterinary nursing.
Brilliant, thank you.